Most doctors, to be honest, don't understand genetics. Like, we're looking at about a 40 to 50% people who are misdiagnosed just off of your historical health data alone.
No way.
The best doctor in the world is maybe 1% of where our AI is today.
Xavier Serrano is a two-time healthcare founder with over 20 years of experience advancing preventative medicine.
As CEO of Marqi Medical, he leads the development of an AI-powered platform that helps physicians detect disease early, optimize longevity, and deliver personalized care at scale.
I was shocked by what they were willing to do for profit.
Profiting off of sick care is a huge problem. And if I can give this stuff away, I would. You know, healthcare is a journey. You know, like, we're never a finished product.
Anything in life, I think, if you want to get good at it, you have to be consistent in, right? Whether that's making money or bettering your health.
Back in 2000, my dad nearly passed away. He had a heart attack. It's called the Widowmaker heart attack. He's got like a 5% chance of surviving it. When you see your hero laying in a hospital bed, you know, helpless, and you think that he may not make it, which at the time we didn't know, it sort of felt like a calling, you know, just kind of like, you know, God, if you can just let him, you know, continue to live, you know, I want to dedicate my life to helping people. So I kind of made it my life's mission is to bring forth the technology and intervention that can early detect and prevent these diseases.
What's wrong with today's healthcare system that Marqi Medical and your team is looking to solve?
Where do I start?
Inspiring business leaders. Voices that move the world forward.
Welcome to Inspiring Business Leader. I have the most inspiring business leader today because he is looking out for your health using technology. Incredible Xavier Serrano, welcome to the show.
Yeah, thanks so much for having me.
Tell me more about you, your story, and then how Marqi Medical came to be.
Yeah, so I've been in the healthcare industry for the past 20 years, mostly working as an insurance broker, overseeing group health plans, insurance captives, and you know, sort of building the infrastructure for health plans to manage chronic disease. Back in 2000, my dad nearly passed away. He had a heart attack. It's called the Widowmaker heart attack. He's got like a 5% chance of surviving it. And you know, when you see your hero laying in a hospital bed, you know, helpless, and you think that he may not make it, which at the time we didn't know, you know, I sort of felt like a calling, you know, just kind of like, you know, God, if you can just let him, you know, continue to live, you know, I want to dedicate my life to helping people early detect these diseases, you know. So that was kind of a pivotal moment in my life that kind of made me change my trajectory. I was in a very successful, lucrative healthcare career, but that was sort of just part of the cogs in the wheel where I wasn't really making much impact or much of a difference, even though I knew what the answer was. Because my father, if you look at him, he's got, you know, 15% body fat percentage, exercises regularly, sees his doctor regularly. By no means would you think that, oh, this guy's about to have a heart attack. And that's the sad truth is I think about 80% of people who have heart disease, particular heart attacks, are asymptomatic. So wow. We have no idea. Yet the technology exists today where we can do an imaging called a calcium score, CT calcium score. We can find out exactly how clogged your arteries are and how close you are to having a heart attack. And for my father's case, I think it was around 1,500 or so. Anything above 300 is bad.
Wow.
So he was very much on his way. And again, just this data exists, this technology exists, but again, nobody knows that it exists out there. So I kind of made it my life's mission is to bring forth the technology and intervention that can early detect and prevent these diseases.
What's wrong with today's healthcare system that Marqi Medical and your team is looking to solve?
Where do I start? How long do we have here?
Well, we have about an hour and a half, so you can get started.
No, I'll hit over some major points, but the way I describe it is it's a dinghy with 100 holes. You know, so it's not one particular hole. Some holes are much bigger than others. You know, the fact that it's a for-profit entity is a huge problem, and that's where it kind of starts. And it ends with physicians having over 2,000 patient panels. So they, even though they are good people, I've met with a lot of them. I have a lot of them that we have under contract. They just can't help people because they just don't have the resources or the time to do so. So where we come in is we're just doing the complete opposite. So think of healthcare as a triangle, and most of the care goes into, about 95% of the care goes to taking care of diseases that are already managed. So that's what your doctor does. They're very good at figuring out, hey, what are your symptoms? Let me go ahead and find solutions to that. Where only 5% goes into prevention. We're doing 95% prevention and 5%, coordination of care and specialty. And it's probably growing for us as we have strategic partnerships like Pinnacle Care that helps with some of those things for our members. But most of everything that we're doing is how can we get you at the peak performance, optimal health, and so we can early detect and prevent chronic diseases.
What is preventative health? Can you name a few things that you guys do in that space? Define it for me.
Yeah, so we have 9 different disciplines that we're looking at into your health. So one of them we talked about is genetics, right?
Yeah.
So most people, and even most doctors, to be honest, don't understand genetics. Like they don't have a discipline for it. They're kind of like ER doctors. They're like, hey, look, I've got someone who's about to die here of a heart attack. I got to take care of him first. And then I got to take care of the guy who's bleeding out because, he was doing something stupid in his garage and fell down the ladder or whatever. And then I'll get to your migraine at the very end of that. And nowhere in that list is, hey, let's find out if you have a hereditary risk for prostate cancer, which is most prevalent amongst men, or breast cancer, which is most prevalent amongst women, where it's actually a very simple test. It's a monogenic genetic test. You can find out if you have a BRCA gene mutation, and with that gene mutation, you can find out if you have a lifetime risk. So for women, it's about a 70 to 80% chance of having a lifetime diagnosis of breast cancer. Actually, in general population, we have about 50% chance of having cancer.
Wow.
In our
Has
lifetime.
that always been?
Always been.
It's been like that.
Yeah.
Wow.
So you got a 50-50 shot. And then the other part is closer to some kind of cardio metabolic risk, and then everything else that's in there.
So you're doing tests for people. You're using AI to analyze these, and then what? How does the process?
So we do all the testing. Then the AI looks at these 9 different disciplinary health modalities, and we look at cross-referencing of causality and correlation, right? So maybe you have a genetic predisposition to something and something showing up on your labs, and those two things are connected. On their own, any doctor would say, yo, that's nothing, right? So we've actually done this with a number of people where we look at just your 10-year historical health data and we go, hey, you had a positive ANA, and you have all these symptoms, you probably have an autoimmune disease where that was actually missed. So I think we're looking at about a 40 to 50% people who are misdiagnosed just off of your historical health data alone.
No way.
And we're able to look at this because AI in our algorithm has basically the widest amount of knowledge that any human could never possibly have. The best doctor in the world is maybe 1% of where our AI is today.
And how did you come up with that algorithm? Did you consult with other professionals in the medical community or technologists? How did you come up with those algorithms?
So all of the above. Yeah. So we consulted with a number of industry experts and in each one of the disciplinaries. So we have 9 different disciplines. So we had to get data in for our genomics information, for our metabolic risks, for our gut health, and so on and so forth.
What's the truly groundbreaking thing that you've noticed from your company so far?
So So what the data is coming back at is 60% of our members, we find a life-changing incident. So something along the lines like you're pre-diabetic, right? So not necessarily bad, but you're like, hey, you're headed in this direction. And that's just one example. 40%, we're actually finding that we have a life-changing finding. So that means that we're finding that you're back to the diabetic, so you're already diabetic and you had no idea, or you have early stage heart disease. So someone like my father is like, hey, you're headed in that direction. You're probably months or years away from having this disease ultimately take your life. And then about 4% or 5% of the individuals, we have a life-saving finding. So that means that we're already finding a stage 1, sometimes stage 0 cancer that would ultimately, obviously, take your life. What's nice about what we're finding is that we're finding it so early that it's very non-invasive procedure, typically outpatient, biopsy, something along those lines, and you're back and running the next day. Where, of course, if you find these things later stage, your survival rate goes down significantly, as well as radiation and chemotherapy in that example that really changes the quality of life.
Amazing. So you're finding problems or even potential problems before they come so chronic that you might not have a way to solve it, or you might die if you don't take care of it.
Yeah.
Amazing. So, I don't want to get too political here, but we have a new administration and we have a new HHS person in charge. Controversial to some maybe a godsend.
Yeah.
Spending all this time in the health and wellness sector and hearing what Mr. Kennedy has to say about food, vaccines, some of the ways that healthcare may not be solving these problems for Americans right now. We obviously have an obese, sick society right now.
Yeah.
Do you agree or disagree, coming from the healthcare field, with his positions on some of these foods, some of these preventative things that he thinks we can do to make our health better?
Yeah, I'm very hopeful. I'm someone who kind of went more Republican and voted for Trump because of the fact that I was very hopeful, and I see this as a huge crisis in America. And I think Bobby Kennedy's ideas on what we can fix about healthcare are right on the right path. I think big food and big pharma are just owning our healthcare system, and it shouldn't be the case.
Are there any things about his policy or changes he's wanted to make as of recent, or even just historically legacy-wise, that you've heard him talk about over and over that you're like, yeah, I come from healthcare, that's been an issue?
Yeah, regulation on both of those industries, I think are long overdue. There's a ton of issues that are happening right now with lobbyists and pharmaceutical companies that are taking too long for drug exploration, FDA clearance on medication in the U.S., as well as just in general. Profiting off of sick care is a huge problem, and it needs to change, and we need something like what we're seeing, or I'm hoping we're going to see, in order to drive that change.
And looking to innovation and technology with people like you that know what some problems are, and using AI to change the world for better, for people's physical health. But what about mental, emotional, spiritual health, energetic health? I mean, do these things play into disease as well for people?
Yeah, they're all intertwined. So you can kind of like think of it, healthcare has like this cycle or this circle, where everything's intertwined, everything's connected, right? Like the food's connected, your exercise connected, your mental well-being's connected, your emotional well-being, everything is kind of in this circle. So one deficiency in one area carries over to the others. Right now we can only take on so much at Marqi, so we're not taking on a lot of the mental health aspects of care. We have some small variant of that. We're looking to expand on it. But we have literally, we built the world's fastest car. We can get it from 0 to 60 faster than anybody. Yeah, we can go a little bit faster and get it to that top speed where we include mental health. But we feel really good about where we're currently at. And even taking a fraction of what we're doing, which I would call, maybe 10%, doing a look back period on somebody's 10-year historical health records, we think that we can get a 40 to 50% early detection or misdiagnosis on someone's healthcare just doing that program alone. So I think that's a low hanging fruit opportunity for healthcare, and we're beta testing that here in San Diego. So I'm really excited about that.
Can't wait to hear the results. That's going to be amazing. You deal with some highly functioning, busy, and probably stressed out people. Talk to me about stress for a minute. I know that we've talked about your market before. These are high functioning, successful people. I know you want to help people of all branches of life, but maybe your services might be more geared towards that demographic, for instance. What is it with high functioning people, and why did you decide to go after those people and help them? What is it about their lifestyle? I know that, we mentioned, again, they can afford it maybe, but is there other reasons why you've chosen to go after CEOs, company owners, entrepreneurs, successful people?
Yeah, it's a really good question. Initially, I wanted to do something that everyone can afford and everyone could do, but we just don't have those kind of resources. If you want to go high volume, low cost, low margins, like that's a whole different game that you have to be built for that. So we're a very lean startup company. We have to do things where we can have higher margins and start with lower volume. And the profile of the people that we're starting with just tend to have that natural high functioning. You mentioned high functioning, but it's more of a someone who's looking to optimize their health. These guys are looking to get the edge in their business. They're looking for the edge in their health, and they're willing, and their companies are willing to invest into their long-term health. And a lot of times there's company programs, which is the first company I started was Marqi Health, and we actually built the first insurance program specifically designed for executive healthcare. And we have this program, so not only is it an incredible program that everyone should be investing and everyone should be doing, but we also built a mechanism so that the company could sponsor this program, and it could be part of a executive retention attraction tool, as well as you can see a tangible ROI in the business.
Have you onboarded anybody for this program yet?
Yeah.
Oh, and how is it working so far?
So far, it's great. I mean, we've got about a 95% satisfaction score, NPS satisfaction score. Everyone's extremely happy. Our report is incredible. It's the most comprehensive, world-leading precision healthcare program. And I say that because, number one, I've seen and worked with some of the companies that are doing something close to this. Most companies are only about doing 10 or 20% of what we're doing. But this report and our analysis gives you everything from your meal plans to grocery lists to supplements to medication, meditation, everything in between to really put this together. We take it as easy as, if you're a busy executive and you just go, hey, I just want to hit the easy button, send me the food to my house, put me in touch with my trainer, have my doctor write the prescription, send me the medication, send me the supplements to my house. Like, we do all of that from start to finish.
So it's like concierge wellness, essentially, that you've created with this program. Were there any competitors in the market space that you took this idea from? Or is this just your own brainchild?
We definitely borrowed from some of the markets, some of the folks that are doing something in this space. But I actually had the luxury of working with one of the world leading and one of the first companies that was doing this for a number of years. But what I noticed was that companies were saying, yeah, Xavier, this looks great, but it doesn't scale. Most of my executives are in New York, San Francisco, Chicago, Boston. Your stuff is in San Diego. Like, we just aren't going to get to you guys. We're not going to get there. So we had a scalability issue. We also had a retention issue where we were getting a bunch of people signed up and then they didn't return. And the reason is that a one and done doesn't work. If you just give someone a report and say, hey, thanks for coming here, see you next year, best of luck, you're just not going to get the outcomes, right? It's like training at a gym. It's like getting coaching. You're not going to be a great tennis player or basketball player or golfer if you just go one time on the range, even if you work with somebody and that's it. Like, you got to be consistent. You got to do your follow up. You watch your videos. You got to do all the stuff that you need to do to get better at this. And that's what we built. We've got coaches, which are registered dietitians and personal trainers. We've got physicians, and then we have a broad referral network that's going to work on your particular need or deficiency in your body.
Amazing program, and the consistency effort. I couldn't agree with you more. Anything in life, I think, if you want to get good at, you have to be consistent in, right? Whether that's making money or bettering your health. Going back to your father's story, you mentioned that he had this Widowmaker. Was there anything about how his diagnosis, treatment, healing went down or got better? I know you mentioned it helped fuel some of your desire to create your company. If he would have had something that you had available now at Marqi Wellness or Marqi Medical, would it have helped him discover that the symptoms before that happened to him?
Yeah, absolutely. I mean, as I mentioned before, a CT calcium score is going to tell you exactly how much plaque you have in your arteries. So you can kind of think of it as like a hose, in your arteries, and it's got buildup all around it. What's nice about your teeth is you can see it, right? And you're like, oh, I probably should go to the dentist. Like, I'm getting a little plaque buildup in my crowded teeth, right? Well, the same thing happens internally. Both not even just for your heart, but tumors. There's stuff inside you, and sometimes they're benign, right? And we have the luxury of things that you can see in your face. You're like, oh, that's a weird mole on my face. Like, that got a lot bigger. Let's check to see if that that's cancer. We now have the technology. We can do that in your body through advanced imaging. And by the way, the MRI machine doesn't even have radiation, so everybody should basically be doing that, especially if they can afford it, to be doing it at least once a year. And again, back to the genetics. And advanced blood work, if you have a predisposition for cancers, or you have elevated TSH or different levels in your blood system, then you should be doing those tests every year, because you already know. You're like, oh, well, crap, I got this gene mutation, and now I know that I have a 70 to 80% higher risk for getting cancer. Why the heck wouldn't you get that done every year?
Maybe they just don't know.
Most people don't.
Right.
Most
we got
people
to spread
don't.
the message. That's why you're here today.
That's why I'm here.
Get that out, man.
Yeah. I mean, I love my physicians, and a lot of them, like I said, they're overworked, underpaid, underappreciated.
Yeah.
They just don't have the resources, and a lot of it has to do with insurance, right? If insurance not going to pay for it, then they're not going to recommend it, so they don't even get into that conversation. So we just want to make this as readily available as we can. I just gave you kind of an explanation how thorough our program is. So obviously we just can't offer that to the masses. We don't have that kind of capacity. It doesn't scale yet. But I'm hopeful with the technology advancements in the next even year or two, we can actually scale this thing down pretty far. There's advancements in imaging, advancements in AI that's going to really help us get this thing down market. But we got to start with the folks that we know are driven individuals who really want to optimize their health, and of course their companies will sponsor programs like this.
Amazing. So it's not just the individual executives, corporate wellness sponsorship, getting the company to help their employees get better and well and stay well. But you mentioned when we first started talking that you're helping people with, I mean, do you have like an assessment on your website or something where you're like, hey, even if you can't go through our concierge wellness program, we still want to help you. Can you tell me more about that?
Yeah. So So I'm very driven for the cause, and if I can give this stuff away, I would. And you know, what we built in our program on our website is you can actually get a free health risk assessment. So you can run through a version of our AI that just looks at your medical history, your symptoms, and we will give you all the tools for free. We'll say, hey, look, you can go ahead and take this quiz. It's super simple, takes about a minute or two to complete, and we'll tell you exactly what tests to ask for, and where to go, and what your potential risks are just from taking this free online quiz.
Amazing. So you providing some resources from that quiz, and people can go do their own research.
Yeah.
Even the tests that you're recommending, can people get those other places individually if they want to?
Yes and no. So some tests you can do on your own. So you can do a gut microbiome test now online fairly easily. Hormone tests are actually much more readily available now, although I do kind of caution people kind of doing that stuff on their own. I know a lot of people who did that on their own, and they shot up their testosterone way too high, lost a lot of hair, didn't know exactly what they were doing. So that's why it's good to have a doctor.
Yeah, I did one of those testosterone pellets in my upper buttocks, and I was like a raging bull. I don't know if I really needed it, to be honest. People were like, "What's wrong with you, Rick?" I'm like, it was wonderful. I had a lot of energy, but I got a little aggressive from something like that.
You get very aggressive. If you're married, not a good idea. It's a tool, but it needs to be used, and a lot of these things are tools that need to be used effectively and with supervision from a licensed practitioner and someone that knows what they're doing. And that's why it's not just one thing, right? So it's just one area. Hormones and gut health are the two examples that I can give that you can somewhat do on your own, but it's also looking holistically and saying, oh, okay, well, maybe you don't have energy level because of a vitamin deficiency, not necessarily because of your hormones.
Wow.
And actually a significant amount of people have nutrient and vitamin deficiencies, I think, across the board. If you just took vitamin D, I think that would be at least 60% of our population would be better for that.
Amazing. So great tip. I want to go back to the parasite topic because I've been hearing about this. I've spent the last couple decades in wellness myself in the spa and wellness industry. And I hear a lot about when, you could get parasites from going to a foreign country, drinking the water, maybe eating sushi that's not cured right or has parasites, worms in it.
Yeah.
Is that something that a lot of people might be dealing with and they don't know they have that going on?
Oh, 100%.
And what does that do to the body?
It depends on the parasite. So I'm actually one of those people. So one of my main issues that I've actually dealt with is actually gut health related. So I did have a parasite. I did have macronutrient deficiencies, and then I'm still getting better. And even just understanding what my natural inflammatory markers are against certain food allergens and things along those lines. So they're all related, right? And sometimes it's a combination of different things. So I grew up my whole life thinking that having inflammation and issues with dairy was just kind of like my life. And I'm like, God, that's so weird. I didn't think I had dairy. And come to find out, it's actually gluten. And I'm like, oh, well, I had no idea. And sometimes I can have a little bit, but if I have too much, so then that combination. So you can never really pinpoint it. But if you're doing the tests like what we do, we're doing gut health, food sensitivity, micronutrient, heavy metals, and a full gut health panel, and then looking at all of those, kind of how they work together along with your genetics, you can really get a more comprehensive look at what's going on in your body. But yeah, leaky gut is one of the major issues with having parasites. Leads to brain fog, fatigue, all kinds of other issues related to inflammation.
What's the number one issue that you've been noticing, either when you were in the healthcare industry or transitioning into the wellness industry? What's the biggest issue that you're seeing right now with people's health?
That's a really good question. So one of the I guess surprises that I found out was the lack of energy and libido, and it's like one of those things that just no one would ever talk about, right? Like you wouldn't naturally have that insight. Your best friend's probably not going to be like, hey man, I like can't get out of bed, or I don't have the sex drive that I had 20 years ago, or even like a year ago, right? And the problem is it's like a slow burn, like we're going from, for men our peak is probably like when we're 30, at least for me, maybe sometime in my 30s, 35 or something like that. And it just, you get like 2% slower, and then 2% slower, and 2%. So you don't even notice it until you get to the point you're like, man, this is like, just what the heck is going on here?
Just drink more coffee.
Yeah, drink more coffee. And
speaking of, does that have an effect? Does our coffee intake? I feel like coffee is like a drug that we just take a lot of. I mean, I do.
Yeah.
I'll speak for myself.
Right.
I went from half a cup to a cup. Now I'm at 2
Yeah.
cups, 2.5 cups. I mean, caffeine is.
Yeah.
It seems like we're living on this stuff. Does that have an effect on our health?
Well, coming from a coffee lover, so I'm getting a lot of people angry at me for what I'm about to say. It doesn't actually help you in the way that you think it does. It actually just keeps you from knowing that you're tired. So it actually doesn't do what you think it's doing. It doesn't give you energy. It just takes away that receptor in your brain that says, I'm tired. So number one, it's got that issue going. And then number two, most of our coffee is like really dirty. It's got a ton of pesticides and toxins that aren't good for our body. Yeah, and I was against like the organic thing for a long time, but then it's kind of like the first time someone shows you like under a microscope what like a bathroom stall looks like, and kind of like what's going on. You're like, oh, I didn't know that, or what your pool looks like, and all the stuff that's going on, or heaven forbid a public jacuzzi. So once you see certain things, it's kind of hard to unsee.
Yeah.
So I might be ruining it for people on the coffee thing.
Is there an alternative for people?
Yeah, there's tons of alternatives. I mean, you can do vitamin B12. You can do teas. There's a lot of different options, but it's hard to go off of. I mean, everyone loves their coffee ritual. I mean, I know I do. I've tried to quit many times. I just can't get off of it.
Love coffee. I'm not going to talk bad about it, but I do think, just like with anything good, it has its effects. I feel like the more we rely on it, it breaks down other natural systems maybe that we are now relying on that chemical caffeine to fill in
it's a Band-Aid, right?
Yeah.
And it comes down to like, what's the root cause? So that's what we're really good at Marqi, is like, what is the root cause of what's going on? Be like, okay, you're drinking coffee in the morning and throughout the entire day, and be like, well, why is that? Oh, I'm getting shitty sleep. Why are you getting shitty sleep? It's because you have this vitamin deficiency, or you're just fucking terrible at turning off your phone right before bed, and you're flipping around through reels, maybe watching this right now, and you should be getting your sleep, right?
Yeah.
So sometimes the fix is like really simple, and be like, okay, well, let's monitor you. Be like, we have your doctor hooked up to your watch, and be like, hey, your plan, you told me you want to get up early in the morning and stop drinking coffee and feel better. What you need to do is start a bedtime routine that starts at 9. Okay, so that is your plan. And now your coach and your physician are looking and making sure that you're accountable for that. We pull the report and be like, hey man, it looks like you went to bed at like 11:30 every night, and you slept in until 8. You didn't do your morning exercise, and we see that you pumped up all this caffeine throughout the day, and your heart rate's elevated, and you're drinking Monsters and all this other stuff. Like, what are you doing?
Right.
You're like, oh, yeah, I guess I didn't realize that's what I was doing to my body.
Well,
And
that brings a good point up. I'm an anti-wearable. Sell me. Tell me. I mean, I think.
Yeah.
No, personally, I'll just open up to you. I'm scared of like the signals by my pulse, or I'm scared of technology monitoring my health. Right? Like I'm one of those guys. Tell me why I should change and why I should do a wearable.
Yeah, I mean, it's more data, right? So heart rate variability, monitoring will test your stress levels and give you incredible insights that you didn't have about your health. Oxidative stress, sleep patterns. There's a lot of very valuable data, and also even just the accountability, right? Just like you can't change what you don't track, right? Like you'd never go to a company and say, hey, I want to change sales and bring it up 200%. Be like, 200% from what? Like, what's your baseline? If you don't know what your baseline is, then what the heck are we doing here?
Yeah.
And again, that's the problem that healthcare has, is like there's no baseline. When we do a full body scan and we look at your brain and we're like, okay, we got some white matter on its own, maybe not that much of a problem. But if we scan you again a year from now and that's grown significantly, well, now we have a problem. And nobody gives a shit if you're going to have diabetes. I've had people like, I don't give a shit. I'm going to ride this thing until it goes. And nobody gives a shit sometimes if you tell them that they might have a higher risk for cancer or heart disease, whatever. But you start talking about Alzheimer's and dementia, all of a sudden people's ears perk up. You're like, oh, I don't want that. Be like, well, guess what? Your shitty sleep, your lack of exercise, your significant caffeine, alcohol intake, your smoking habits are all significantly rising your risk for dementia. You already have white matter in your brain. Now we went from 2 or 3 lesions to 25 to 50 lesions, and you have an ApoE gene variant that shows that you have a predisposition for this. Now I've got that person's attention. Now it's like, do I really want to do that to my kids? Now we have data that tells you what trajectory you're going to, but more importantly, what you can do to limit or reduce that risk. And I think that's the part that people are missing. People are like, I don't want to know. Like, we're not doing a crystal ball saying that on May 7th, 2030, you're going to die. That's not what we're doing. What we're saying is here are the streets that you need to avoid, and how you can avoid them, or here's the route, and give you that GPS navigating your healthcare.
What's your vision, your 5-year or 10-year vision for this company?
So right now we're working on kind of more of a direct to consumers or direct to business approach to healthcare, and trying to get the word out on what we're doing, and frankly transforming and saving lives. We're doing this very systematically, given the resources that we have and where healthcare is. But it's our hope to bring this to the masses and scale this, and so it is part of a major medical offering. We got to build up a lot of data to be able to say, hey, look, here's where it's changing. You talk about the issues with healthcare. Single payer, I know that people hate when I bring this up, but single payer is a version of single payer is a solution to this, because ultimately you got to have one P&L. You can't have multiple payer systems that are fragmented, saying, hey, look, you're with this insurance company this year, and you're with this company this year, and ultimately you're only staying on at a job or at an insurance company every 2 to 3 years. No one has a long-term vision for your healthcare. Nobody wants to save you anything. That's why I can't go to the insurance carriers today with a program, which I have, and say, we've got a solution how we can early detect all these chronic diseases, cancers, brain aneurysms, diabetes, so on and so forth. And but the cost is too grave, and the long term, the payout is too long term for them.
Why is our healthcare system in the richest country in the world? How can we rank so low with the innovations, the smart doctors, the pharmaceutical companies that are supposed to help us? Why are we so low in that if we're so advanced?
Well, we're actually pretty high in the sick care model. So if you are sick, this is one of the best countries in the world to be at. The problem is our farm, our farm system to getting people there is profit driven. So we're not doing. So back to the Bobby Kennedy talks about what we need to do is, we can't allow for food to have all these issues with pesticides and different toxins going into our bodies. We need to be able to regulate the pharmaceutical companies, regulate the insurance companies, and healthcare. I mean, it's a huge undertaking. Whoever does it's going to be very unpopular for a long time. I think we're brainwashed to think that open market system is the best thing for us. You don't want to be waiting 6 months to go see a doctor either. So you don't want that. But you also don't want it to be a for-profit entity where they go, hey, the more tests that we run, the sicker you are, the more money we make. Where's the incentive here for me to kind of take care of you?
Yeah, it reminds me of the opioid crisis. I don't know if you studied Purdue and how the marketing people went to the doctors and the incentives. I mean, that was so sinister, that story. It still is, and it's causing 75,000 deaths. Yeah. People 18 to 34, the number one leading cause was from that.
Yeah.
I mean, obviously the pouring in of fentanyl and people getting hooked on drugs, but wasn't that the symptom, the problem that started this?
Yeah.
I mean, that's part of our healthcare system legacy. I think that's a disgusting story. I've studied that extensively, and I was shocked by what they were willing to do for profit. And
to some extent, we're still experiencing that.
Exactly.
So you can look at that and say, oh my God, that's disgusting. We can fast forward, 10 years from now and look back to right now and be like, oh my God, that was disgusting what healthcare was.
And I think that's what Bobby Kennedy's doing, is he is upsetting and uprooting. And in some ways, I think Trump is too, with curbing the tariffs, that open trade with China, or the unfair trade with China, the unfair health systems. I mean, we have an administration now that's doing more than the history any administration has done in the 100 days of any, of changes, of trying. And I know people are upset. People don't like change, right? Even if it's good for us, people don't like change, or there's partisan politics, and people don't want to look at, sometimes when they go to a side, they don't want to look at the good things that are maybe being brought into the fold right now that have needed to be fixed. For instance, consumerism's out of control. 50 years from now, if we don't do something with these plastic and cheap goods that are filling in the landfills, in the lakes, they get into our bodies too. Talk about health, right? Yeah. The plastic and the toxins that are leaching everywhere, they have to be also affecting our health.
Yeah, right here.
Yeah.
I had all my toxins. I've got mold, and I've got plastic in my body.
Wow. And you're not the only one.
Yeah.
Right?
But again, I just happen to be lucky enough to know that these tests exist. Wow. But again, most people be like, oh, I have fatigue because I'm getting older. Oh, I have fatigue because I have low testosterone. No one ever thinks, oh, maybe I have, toxins in my body from the food that I'm eating, or what I'm breathing in, in my office, in my home, or whatnot.
Do you have kids?
Yeah.
How many?
3.
3. And what is your concern, or the ways that you combat this world right now to help keep your children safe or healthy?
It is freaking hard. Every day, just about every day, there's like candies and sugar galore at the schools. And, we have to work. So we send our kids to, after school programs, and they give them these cookies and candies. And, we've told them several times, like, hey, can you not do that for our kids? Like, we're trying to keep them off of sugar. And my son's addicted. He's 100% addicted to sugar. I don't even remember what we have this bag from. I think it was Easter, right? Yeah, Easter. Oh my God. And the holidays don't stop. It's like, if it's not Easter, it's Halloween. If it's not Halloween, it's a birthday. If it's not this, it's so we have this huge bag, and we're like, okay, one every now and then, one a week. We don't want to be like, hey, we're crazy. You're not going to get candy ever. But in moderation is fine. He's so addicted. They grabbed the bag from above the fridge, so they climbed up the fridge, and my son grabbed it, and then he put a stash in the bathtub of the guest bedroom that we don't go into. And he and his sister for like the last week have been going in there repeatedly. And then we found it like we found a freaking squirrel, bag of nuts. And then we just see all the wrappers and was like, oh my God.
What are you gonna do? I mean, do you discipline your kids? Do you tell them this is not how this is gonna happen in this house?
You can ask my 4-year-old what happens when you eat too much candy. We tell them what the consequences are, and the consequences aren't I'm gonna come down on you. The consequences are you're gonna have diabetes. You can ask my daughter today. We can call her up right now and be like, "What happens if you eat too much candy?" I get diabetes. What happens if you get diabetes? You get a shot every day. Do you want a shot every day? No. So she'll tell you.
Brilliant.
So we give them the full insight as to what the consequences are and why I don't want you to do it. And I think, if you do that with children, if you do that with adults, be like, hey, I don't want you to gain. I'm not like anti get heavy and everyone should look like a model, but understand that if you are obese, you have a much higher likelihood of having diabetes. If you have diabetes, you have a higher likelihood of having cancer and heart disease. Mm-hmm. So you're effectively killing yourself by having all these bad habits that, again, not everyone has a parent that knows all this stuff. I for sure as heck didn't. We stayed up as late as we wanted to. We ate crap. Growing up, like ramen noodles and mac and cheese, like pretty much every day, and wow. Donuts and bagels. We had absolutely no oversight as to what we were doing. And now I'm seeing it with my parents. They're paying the price. My parents are not in good health. I started this company to help my dad, my mom get better, my wife to get better, my siblings, my community. And it's working. I mean, everyone who's gone through our program, incredible insights, stuff that you would never know about yourself in a million years if you just worked on it on your own.
Wow. Well, it sounds like you're a great communicator. Can you tell me more about the communication of how you're communicating your message to your family, to the people in your community, to your parents, like you said? Is there a way to kindly but sort of put some urgency into living better? Like, what does communication mean to you, and how do you bring that to your family and your community?
Yeah, I mean, it starts with education and just empowering people, just getting the message out to them, letting them know, hey, here's what's actually going on in your body. Here are the different things that you can be looking at. And, it's kind of like helping an alcoholic in a way. Like, they have to be ready to receive the message. Like, you just can't get to somebody unless they're ready for that message, And not everyone is, but we're trying to get to the people that don't have the means. They can watch a podcast and be like, great, let's go ahead and get to those folks. They can go on our website and read the 100 different articles I've written in the past year on health optimization and chronic disease prevention. And let's give them the tools. Those are the people that I feel like we really want to reach, are the people who don't have the means, but they're gritty and they want to get out there and they want to learn. The people who are kind of on a path of, hey, I'm going to just close the blinds and close my eyes or put my head in the sand. Very hard to reach those individuals. But the folks that are looking for ways to optimize their health, the biohackers, the health optimization, the high achievers, those are the people I think are going to be the early adopters. Then as you see your friend, you're like, whoa, this person like lost a ton of weight. They look great. They look 10 years younger. And you're like, what are they doing?
Were you a subject of that? Were you a subject of your own, where you're at now? Did you have to change your lifestyle and yourself? Or did you ever face being overweight or not disciplined with your diet or not getting these tests? Like, what about your own transformation?
Yeah, that's a good question. So, healthcare is a journey. like we're never a finished product. There's probably 1,000 deficiencies in any human individual, including myself. I mentioned my gut health and understanding all of that. I'm still working through a lot of that. Like I still haven't got the mold completely out of my system, although I'm due for a checkup here pretty soon. So I'm hoping that's cleared. We're still working with a lot of my gut inflammation issues. So I've gone from not knowing to knowing to doing something about it, and then now retesting and rechecking, because you want to look at your health a little bit differently. It's not a pass or fail. It's a continuous improvement. So I am 30% better than I was a year ago, and that's good. But I'm really eager to, even in the next 3 months, because now I'm in my cutting phase. Prior to summer, I put on a bunch of muscle, which was awesome. I don't have that issue. Some people do. But my issue is, cutting and being more effective in doing that. And then also all my gut health and inflammation issues that I have. So, I'm a work in progress, just like anyone else. Generally, people think that I'm a lot younger than I actually am. I'm 43 years old right now.
Wow.
But most people, most people think that I'm, considerably younger than that, or at least a little younger than that. Which, at least says, hey, I somewhat have something figured out on how to age well and age gracefully and optimize my health.
Well, it sounds like you're doing a great job and doing what you can and consistently doing it, which is always good, right? Even if you have issues, you got to still try.
Right.
And I think a lot of people that get issues, maybe they just sort of give up. Let's talk about how many data points you're checking, why is it important, and what does it look like, the process with your company?
Yeah, so I guess to give you a little bit of perspective, when you're going to a regular physical, so an annual checkup, which by the way only 20% of people do, you're only looking at 12 data points. So if something gets flagged in those 12 points, then great, and maybe it moves on to the next step. But as I mentioned earlier, these doctors have over 2,000 patients. So unless it's, glaring problem that you're really complaining about or really chronic, they're not going to pay any attention to you. What we do is we look at 9 different areas of your health, and we look at 43,000 data points. And not only are we looking at each of those points, then we have AI kind of synthesizing each one of those data points and finding correlation and causation of your symptoms to see if any of those are related. And then we come up with a tailored, customized program specific to your specific health conditions and data analytics.
Wow. That's impressive. I didn't even know we had 43,000 things to check in the body. That's amazing. Let's talk a little bit about some personal development. What are 3 virtues that are important to you from your philosophy on how you live your life?
Yeah, so like core values kind of thing.
Sure.
Yeah. I think it's important to maybe just start with, I think something that's kind of doing the right thing. I think that, and I don't know that that's the exact word that I was looking for, but trying to put our clients first, or putting community first, is really important to us. I started the company because I don't want it to be about me. I don't want it to be about profits. I want it to be about, how can we best service individuals? How can we give them the tools and resources that they need to succeed? And I think that everything that we do kind of stems from that, from that core value.
What about you personally? What do you value in yourself and how you treat your family or your friends or maybe your community?
I think transparency is really important. I think it's kind of a lost art. I think people are ghosting each other and not being, fully transparent. I like to be very honest. Sometimes that gets me in a lot of trouble because people aren't like, I wasn't expecting you to tell me exactly how you feel. But I've gotten better of it too, because I used to not be as good about it. And I think throughout the years, I've just gotten like very direct in telling people, hey, this is exactly what I want. And I want that kind of transparency back. So everyone that I have working with me or my family or anyone who knows me, it's like, I want you to tell me if I'm being a jerk, if I'm not being sensitive, or if I'm over communicating or under communicating, what the issues are. So I think that's an important, well, at least what I feel is an important trait or value.
So transparency, honesty. Give me one more that you live, personal life, not professional.
I'm always striving for perfection. So as I mentioned, I'm trying to be the best version of myself, as I think more importantly as a father, and trying to be a good role model to my kids. There's a lot of stuff I had to change, as I think many parents, like I used to like cuss a lot, and I don't do that as much. And mostly because they're little mirrors of you, right? So like whatever you do, they sort of pick up on it. So if you think your kid's a jerk, you should probably look in the mirror. You're probably not a good person. Like they learned it from somewhere.
Right. That's good. That's a good one.
I think it's important to just kind of have that realization of like, what you put in is what you get out. In life and in your personal relationships and in yourself.
And I think some people, is there a balance between selfishness and self-care or taking good care of yourself? Where's the balance between like you have your family and your business, but you still need to take care of yourself? What's your viewpoint on selfishness versus healthy self-care?
Yeah. I think that's one of the biggest problems actually that we have, is that most people will put their family, especially women, first. Most men will put their business first. But the reality is if you can't take care of yourself, you're no good to anybody else. You're just kind of burning the candle on both ends. And it brings me back to the example of when you get on a plane. Like what's the first thing that they tell you, which we all ignore because we've heard it like 1,000 times. We're like annoyed with it.
Put your mask on first.
Yes, you got to put it on yourself first, because otherwise you don't do it. And
sure.
Back to kind of my background is I did lifeguarding for some time, and when you're trying to save somebody, and this is counterintuitive to what you're thinking, you're actually supposed to put the individual's body up against the rock so that they take the brunt of the force of the wave and they kind of rescue you. And the reason for that is if they get knocked out or something happens, that's okay. You're still there and you can still swim both of you guys ashore. If you flip it around and let your body crash into the rocks, you're actually going to be no good to anybody else. Now you're passed out, they're passed out, you guys are both dead.
Right. Wow. That's a good way to look at it. I never thought of it like that.
Yeah.
I didn't know that that's how it worked. What about some books people can read, either on health or on business? Do you have 2 or 3 books that are your favorite that have taught you some of the greatest lessons in your life?
One of the books to think about for people who are wanting to get a better understanding of this space is Outlive by Peter Attia. So that one gives you a really great perspective as to what this whole movement's about, why it's important. He's a physician, so I definitely like his take on it. I think people can read it and kind of get a good understanding. It's a little meaty, so I would say definitely listen to it. I do have some chapter recommendations, which I'll leave in the comment section. So for people who are like, this thing's like really long, I don't know if I can get through it. I've got you. We can get through just a few, maybe 4 or 5 chapters that are really, really good, because he gets super in depth. And then from a personal success or a personal book, I would say that The Art of War, Sang Soo, I think was probably one of the first books that really got me to change my perspective on life. So it's a very old book, been transcribed thousands of times, has stood the test of time for thousands of years. But it really gives you an insight as to a lot of different power dynamics and people dynamics that you wouldn't necessarily think of. So it's this ancient Chinese general and some of some of the I guess values and different strategies that he used to become ultra successful.
Great. Awesome. What's a virtue in others that you really respect, and why?
I'm attracted to people who are different, and what I mean by that is that they have a different perspective in life. I can almost tell almost instantly whether someone has come from a life that was hard for them, or maybe challenging, versus someone who just had it, super easy. I don't want to diss all the only children out there, but just someone who's been coddled for the majority of their life. Like, I can almost instantly be able to tell the difference. And I just love the stories of individuals who had to persevere either through a physical limitation, or a difficult circumstance, and they just have just a completely different take in life and an appreciation for life that I just absolutely love.
I would call that grit. Is that no? Maybe.
Yeah.
A little bit of grit, overcoming
you can call it
adversity and circumstances, and
that.
persevering from it. Yeah, that's a really good one. Okay, 3 things you can't live without.
3 things I can't live without.
Could be people, could be a philosophy, could be an item.
Well, I'm gonna have to say my family for number 1.
Okay.
I think I'll get crushed if I say anything else. I would say faith in God. I think that's I would say that's number 1. And then a third one, something else I can't live without. I'm gonna go with something completely different from those 2. I would say, something I can't live without. Give me some more examples.
It could be your phone, a car. It could be love. It could be, anything that speaks to you that is dear to you.
Yeah, I'm gonna go like kind of cheesy and super obvious. I'm gonna go with air.
I love it. Air. Okay, good. So family.
Yeah.
What is the next one?
God, faith.
God. Okay,
Yeah,
and air. Okay,
and air.
all right. Hey.
But I'll give you more on the air. So it is funny because obviously no one can live without it. So, but more importantly, so one small adversity that I went through is I dislocated my knee in college doing stupid shit, taekwondo, kickboxing, things I shouldn't have been doing. But you're invincible at that point. But I was completely unable to walk on my own. Showering was difficult. And I was in an incredible amount of pain, addicted to pain pills for a short while. So a lot of the stuff that people take for granted, like just being able to be eye level when you meet somebody, is incredibly humbling, and again gives you just a completely different perspective. Something that I say all the time is that we live in one of the, if not the best country in the world, one of the best times in the world, the best country in the world. You think of people 1,000 years from now, the best kings didn't live with what we have. We have central air, availability of food on literally a drop of a button. You just be grateful for what you have. Like, we have air, you have health. Your worst day is somebody's best day.
Yeah. I read actually somewhere recently that our poverty level is 31 times higher in terms of economic status than almost, I think, all developing countries, or maybe all countries actually. 31 times. That means if you're homeless here, you can go eat out of a trash can by a pizza place. There's probably half-eaten pieces of pizza.
Yeah.
If you're in the Congo, you're eating mud pies and shit. I mean, it's a whole different ballgame. And
Right.
I don't think a lot of people, unfortunately, and I'm not here to judge my fellow man, but I think you're so right about starting the day with gratitude. When things get hard, practicing gratitude. I think that's so important. So if you could snap your fingers and you had one boon for the world to make it a better place, what would that wish be?
Yeah, that's a good wish. I'd hate to like rush my one wish, but I would just say that I would go back to gratitude. You know, it'd be easy to say, end world hunger, or running water, but I think that there are people who have nothing and are happy, and there are people who have everything monetarily and have nothing. And I think that it would just be really nice to give people just that insight and perspective, that they can just feel gratitude for what they have. Because I just think that between social media and a lot of things that are happening, that it's easy to think that your circumstance is not great, or you could have been better. But the reality is that you're doing better than 99.9999% of the entire human population of all time, and you're still not happy with that. You just want that little bit more. So I would wish that upon everybody if I could snap my fingers and give them that.
What a great perspective. Do you think your faith in God, as you mentioned, as an important attribute, has something to do with the gratitude? Did that teach you? Did faith teach you to be grateful?
I would say that it's never just one thing. It's being fortunate enough to be around great people, learn from great people. I think that the fact that I grew up with 6 siblings and things weren't easy for my family growing up here in San Diego, I think that definitely helped me. But just like Arnold Schwarzenegger grew up in a family with hardship. It depends on the individual. So his brother died from it, and Arnold became a governor and successful in at least 4 different completely different areas of discipline, and just some people, the cream rises to the top, and other people, they just let it define themselves, and they're not able to get past it. But back to what we're doing at Marqi is like, there is some element of your body's biology and chemistry that's keeping you from being that baseline happy. I'm fortunate I don't have that. I'm just very grateful, generally a very optimistic, happy person. But I know plenty of people who are generally pessimistic and unhappy people, and I know people that are borderline suicidal because they just cannot get past their childhood trauma that happened 40 plus years ago, and it's like, hey, you're a big boy, you're a big girl, like it's time to let that go. They just cannot let it go. And they can't see the bright side of things,
and the things outside of people. I think sometimes we try to fix that. Whether you're beautiful, famous, rich, doesn't necessarily mean you're happy or you're able to fix that kind of stuff. Right. I truly think happiness comes from within.
Yeah.
It does. And that's where I think the faith part comes in. I think faith is a very internal attribute of happy people. And faith in spirit, faith in God, faith in the universe, whatever you want. I don't care, as long as you're a good person.
Yeah.
If you're a Christian, be a good Christian. If you're a Buddhist, be a good Buddhist. If you're an atheist, be a good atheist. Doesn't matter to me. But yeah, I think we live in a time where we have this compare syndrome with social media, and you were so right to touch on that. Just going back to your kids, do you worry at all for your kids on the future of, I know you're using AI, but are you worried about AI taking opportunities from them, social media, harming them in their mental state? We're talking about the progression of so fast moving in this society.
Yeah.
How do you feel about that for your own children and other people's children?
So I'm going to try to keep my kids off social media as long as possible. So I don't think it's good. I don't think it's good for people to compare themselves to other people. I don't think it's good to value somebody on how many likes their pictures have, how many friends they have. I just don't think those are good metrics for people to value themselves in that way. I think it definitely has its place. Like, I love getting content on social media. I love consuming good content on different topics that I'm interested in: wellness, holistic approaches, medicine, science, technology, AI. So I'm a huge consumer and advocate of that type of social media. I'm not a huge advocate of liking people's posts and things along those lines to see what they're doing. See the highlights of their life. I don't think that's a good way to compare people.
Right. Doom scrolling is what I think they call it these days.
Yeah.
Doom scrolling, comparing. Yeah, you're like, the 90, not 5% of this person's life's miserable, and they're showing you the 5% when they went on vacation or they had a win, and we think, even our lives are just are shit or crap from people's wins that are just the small part of life. I mean, I think life is, my mentor always said, he goes, look, life is suffering. Life's hard work. Hard work's not fun all the time. He goes, stop thinking this is easy. If you want to be successful, it's not going to be easy.
Right.
That's not successful. People don't look at life as it's easy. Speaking of that, I do want to wrap with a little bit of entrepreneur stuff, since this is Inspiring Business Leaders. And if an inspiring entrepreneur is watching this, somebody out of high school or maybe somebody out of college, you went from corporate America to starting your own business. Can you give our audience a few tips on how to become an entrepreneur, what you think is valuable in the first few steps of generating ideas, manifesting those ideas, building a plan or goals? What's your take on entrepreneurship? How does one get started?
Such a good question. So it's multifaceted. I think it starts with having a great idea that you're passionate about, something that you have a distinct edge on than anybody else. So for me, it was the insight of, hey, I understand this whole life cycle of healthcare, from a payer side to a provider to a pharmaceutical to everything in between. So I think that's an edge that I had. And I also had the distinct edge of knowing from meeting with a lot of employers, like what they're looking for and what they want. So then I built a program that basically filled a need. I think too many entrepreneurs start out with a technology or service that they're interested in, so they kind of do the opposite. So instead of finding the problem, or they try to start out with the solution. They go, oh, this thing's really cool. Let's see what we can build a business around. And then once you have the idea, it's about surrounding yourself with passionate individuals and a great team. So a big part of what businesses, what investors look into when investing into a business is like, who's the team? What's their passion behind this? What's their mission? And if you have those, you've got at least a fighting chance to have a successful business. And then you just have to be crazy enough to just keep doing it no matter what happens.
Is it hard?
Yeah, it's incredibly hard.
What makes it hard?
For me, it's all the nuance and regulatory and compliance, just stuff that big picture people don't love, like all of the little nitty gritty detail stuff. Back to the team, then align yourself with someone who loves the fine detail. I got married to my wife because we're complete opposites in a lot of ways. So she loves the details and the organizational stuff, and I love the big picture and the sales and so we complement each other really well. With your team, you want to do the same thing. If you're not good at finance, go find someone who's good at finance. If you're not good at marketing, go find someone who's good at marketing. Just try to fill in complementary roles, and you'll be much more successful in finding a bunch of yes people and people who are very similar to you.
Wow. Chris? Chris and I talk about this all the time because we we have different approaches, same thing. But you don't always get along with somebody that has a different approach.
It's hard. It's hard
sometimes,
Yeah.
right? Because
Well,
sometimes
that's the part that's hard about entrepreneurship. You got to do the hard things sometime.
yeah, and you might see things differently. But what I've tried to distinguish is setting my ego aside. Like if Chris has a great idea and it's better than mine,
Yeah.
it's like, hey, okay. And I concede a lot. There's sometimes, though, as the boss of the company, I'm like, hey, look, I'm sorry, we're going to go with this, right?
Right.
But I'm almost always open to listening to good ideas because I don't know it all. And sometimes I tried something 10 times, it didn't work. And Chris will bring me an idea that breaks out of my mold, and it's like, oh yeah, let's do it like this, or we'll come together is when the real magic happens, right? When he has an idea, I have an idea, he's willing to do it, or I'm willing to do it, and we're supporting each other,
right?
And sometimes strategy is just built on listening to people, listening both ways. I think that's important. So I agree with you 100% on finding people with the different skill sets to fill in those gaps.
Right.
Very important. Well, I think that's. I want
to touch on AI.
Yeah, touch on AI. Go for it. We have 10 minutes left. Go for it.
You asked it, and you asked it as a double pronged question. So we got the first one, but I did want to talk about AI because I think it's super important. So we use it every single day.
Yeah.
And I don't think AI is what people think it is. So people think it's robots that are going to take over the world and put people out of jobs. And I don't think that's what it actually is. It's actually going to help people optimize their skill sets and become 10, 20, 100 times more efficient than they ever were on their own. And my company is doing that. Like we're doing stuff as a small startup company that Kaiser wishes they could do. And they're a multi-billion-dollar organization, and they can't do what we can do because they're the Titanic. It's going to take them, 4 years for them to adopt AI because they have to move so slowly. And we've got like this super fast, nimble jet that we can just zigzag through, all the icebergs, no problem, and get to that destination 10 times faster than they can. And I think that's what's going to happen.
But isn't that going to leave some people behind? Not everybody's prompt masters. I mean, a lot of blue collar workers, they don't know how to create a business plan, use AI and prompt stuff.
Right.
Maybe they work in a manufacturing factory that now AI's come in with robotics, and they don't need those people anymore. That's the only skill they have.
You got to put your big boy pants and be like, hey, how can I learn to do prompting?
Yeah, but not.
It's free.
Not everybody's good at it. I mean, I agree with you. For those of us, and I use AI too. I use Claude and I use Gemini, and I think some of the tools are fantastic. I don't think, though, that it gives new ideas. So the human innovation component of it takes algorithms and data that already is out. And yes, it can suggest things based on those data. So in that way, it spins ideas into sort of new ideas. But it's only taking what exists.
Right.
And so that to me is a big difference between human innovation and AI innovation.
I think they're one and the same. So I think that it's helping you bring some of that innovation. You go, hey, I've got an idea for a story, and here's my idea. What's some successful areas in other businesses or other things that have worked? And then it give me 10 ideas on that. Mm-hmm. And then you take those 10 ideas. I really like this one idea. Let's go ahead and expand on that.
Sure.
Who are some possible guests that would be good for this particular topic? Mm-hmm. And then it gives you 10 guests. And then you go, how can I get a hold of these people? Mm-hmm. Here are their emails. Mm-hmm. Yeah. What are some email prompts that I can write up so that they can go ahead and say, yes, I want that person to be on. I want to be on that person's podcast.
Yeah. Well, Rocky right here, who's our intern, I just turned him on to how to use AI in the professional setting. Like, what did you learn some things by pulling in your goals or getting the interview outline for this from what we discussed in our meeting? Yeah. What did you think of the power of it?
I thought it was pretty useful.
Yeah, it was pretty useful. So he's a little new to it, but
yeah.
I look.
How long would it have taken you to do that on your own?
Like a day.
And how long did it take you?
What? How long did it take you?
A minute.
There's your 100x.
Yeah, but he didn't know it before he was taught it. But I agree with you. I don't think, though, that it's not going to disenfranchise a certain group of people, okay? I think it's going to enable and enhance things. I hope the people that are smart and utilize it for ultra productivity are going to take care of those that don't have the skills we have. Because I don't think everybody's built like us. I think a lot of people are, but if there is a discrepancy between those people, that could affect a large segment of the global population.
Yeah, but we've seen this before. I mean,
not at this scale.
When-
the
when we-
Industrial
when we-
Revolution
yeah.
had nothing to do with the AI revolution.
it's not, but it's the same story told over again in a different way. I mean, they said, and we can even go to something like the dishwasher and the washing machine are going to completely change, and now wives aren't going to be needed, and this and that. And it just gave you more time to focus on some other stuff.
Right. But I mean, if you look at computer programmers, AI is doing that. Data analysts, AI does it better. These are $500,000 million jobs where data analysts, AI can do it better than a $500,000 a year data analyst.
But I don't think that's the case. I think the analyst is just using it, so then they're getting more work done or doing it.
Maybe they don't need as many data analysts then.
That's true.
I mean,
That's true.
I mean,
If you used to need 10 and one of them can do the job for 10,
but
that's
the
efficiency.
innovations before often put out a certain segment. Like the printing press put out people that were handwriting books. Okay, that was one segment of the population. It also didn't put out farmers and scientists and astrologers and artists, right?
Yeah.
It affected one. The Industrial Revolution, maybe it was a bit more positions, yes, but nothing like this. I'm excited to see where it goes, but I'm also nervous. So I share half of that sentiment with you.
Yeah.
But there's a bit of me that's a little bit pessimistic on it too. I don't think it's all good. I think everything has a polarity of consciousness.
Yeah.
Just like hot needs cold, black needs white.
Yeah, for
There's
sure.
a polarity
but
here.
that's always the case. That's
I
always
know.
going to be the
It
case.
is.
I mean, you built roads and now we have all this pollution. Like, of course, yeah, but now it's easier to get from here to San Francisco because we built these roads. Are roads the worst thing in the world? No, they're a mechanism to get you from point A to point B, but it's survival of the fittest to some degree. It's like, look, if you have access to a phone, which I forget what percentage of the U.S. population does, then they have access to AI, and you can use AI to teach you how to do things. And if you don't, yes, you're going to be left behind, but it's not because you didn't have access to a phone. Yeah. So this whole idea of like people can't do it, they can. Yeah. They can. They just need to start.
Right. I just think that, okay, so here's my issue with it, and maybe you can help soothe my soul here.
Yeah.
Is we didn't have guardrails on the phone. Now kids' necks I talked to a chiropractor who said kids' necks are like a 60 to 70-year-old right now. Okay? This is a chiropractic doctor. It's not the only one I talked to. I talked to like 3 about this, okay, because I know chiropractors. They're like, you wouldn't believe what a majority of 18 to 22-year-olds I work on their necks because they're like this all the time.
Right.
There was no guardrails for the phone. They just cast it on us. There's no guardrails for social media. Kids are experiencing depression, anxiety, and all kinds of emotional and mental disorders like never before. There was no guardrails for social media, as we just talked about. There was no guardrails for AI. There was no manuals on the last 2 decades, the last 20 years. We haven't had any guardrails saying, hey, look, let's take this a little slowly. Let's experiment just like you would an FDA trial. 10 years on an FDA trial with a drug. But this is like a drug, in my opinion, in many ways. Serotonin, dopamine release. Right.
Yeah,
it does have chemical, biological effects. And where there's no testing, there was no guardrail done. Like they did these extensive testings to bring a drug to market that has to do with releasing dopamine and serotonin.
Sounds like you're a big fan of big government.
No,
everything should be regulated.
I'm a fan of government having some controls to protect the people over corporations. Just like the tariffs, the corporations slid behind the government, created a mess with manufacturing in China, and now we're going to face a lot of pain, and businesses are going to go out, and that now we have to fix that system because guardrails weren't put in place 40 years ago with free trade. Yeah. The same things I think could happen with technology. I hope they don't, but I also look at historically those kind of things. And so I hope for the best. Yeah. But I'm also cautiously optimistic. I'll just say that. You know, I think it could go well. I hope it goes as good as you think it does. Though.
I think it's going to go over well. Look, there's no guardrails for bears in the woods, but you saw a guy and he got eaten by a bear.
Yeah.
You heard about it in your cave, and you're like, hey, you know what? I hear there's bears out there.
Yeah,
We
but
should
somebody
probably
put
not go
pepper
do it."
spray and a bear horn in his cabin before he ventured out. So I would say there might be guardrails for him. You know?
Oh, I'm going way back. I'm going back thousands of years.
That's unfair. I liked you before. Just kidding. I still like you. You're a very smart man. You're bringing incredible using AI for good. I do love how you're using AI. I think it's an incredible example of how to make the world a better place. So thank you for
Yeah.
being on the podcast,
Absolutely.
my friend.
Yeah, thanks
Doing
for
a
having
great
me.
job. We look forward to your innovations, and maybe we could catch up, when the time is right, and you can talk to us about how this company has evolved on a future episode. And
Yeah.
till then, I wish you the best of luck.
Yeah, I'd love that. That'd be great.
Thank you
I
so
appreciate
much.
it.
So, well, thank you for joining us, Xavier of Marqi Medical, and be good to your friends, your family, the world. Make it a better place, and I will see you next episode.